Okay. Let's see what we got here. Is this gonna be backwards? Probably not. It says drugs with a Z. Okay. So, I have I don't know, I was gonna say I have a complicated relationship with like pharmaceuticals, but it's probably, I mean, complicated, yes, but I think it's also common. Um, I assume that I'm part of like a very distinct segment of the population that has had a lot of baggage with uh, conventional Western medicine. Um, as a little bit of context, I was diagnosed with ulcerative colitis when I was 14. I'm like 31 now, so it's a while ago. Um, and I don't know, I guess I don't know how I happened upon this innate bias against like Western medicine, specifically a bias against taking medication chronically with no hope of a real cure. Because I felt that way immediately after being diagnosed and finding out that there's no cure for this condition, and I would probably have to be on medication for my whole life. Like that, as a 14-year-old, was immediately unacceptable to me, and I don't really know why. I don't know if it was something in my upbringing or whatever, but yeah, so I started out having this very adversarial relationship towards drugs, pharmaceuticals, because I just, you know, I think it was the classic like it's not natural bias, like, oh, it's a chemical, it's like there are side effects, it's going to do something harmful, like it's going to harm me, which always felt very like a very natural bias to have. But if you think about it, it's kind of funny how literally the reason that medicine exists is to do the opposite of harm the body. So it is kind of ironic that drugs were categorized in my head as like a harmful, dangerous thing. But anyway, like I tried various different drugs over the course of my illness before, spoiler alert, having to have my colon removed because none of them worked. And was on prednisone for a really long time. Awful side effects. Anybody who's ever been on it, you know, it sucks. And oh, hi pigeon. Oh, hey Finn, come here. We've had the windows open today because it's like the first nice day and he's really activated. Come here, buddy. Come on. Where's your cranberry sauce? This is cranberry sauce. It came in like a can. Come here. Come lay down. Come lay down. Lay. Good boy. So, trying to remember where I was. Drugs, prednisone, blah, blah, blah. Yeah, so, you know, on top of my existing bias against drugs, I now have this experience during a very formative age and a very stressful time in my life, obviously, like having a chronic illness and trying to figure out how to manage it, where none of the drugs even work. So, you know, it's very understandable that my existing bias would just be strengthened. And it definitely wasn't, it was primarily an emotional bias. Like, it's not like like I would get triggered about Western medicine, conventional medical treatments, the medical establishment, pharmaceuticals in general. That whole category of thing was like prime real estate for triggering Alyssa. And like I tried a bunch of different like alternative stuff to help with my ulcerative colitis, and was very steeped in like the world of alternative medicine and alternative remedies and diets, and like did a bunch of acupuncture, all that kind of stuff. So like I know that in that realm, this bias against conventional medicine, against pharmaceuticals that I'm talking about, is really common. But the reason that this was a topic that I wanted to talk about is because I don't feel that way anymore. And I think that, like when I try to describe my attitude now, it's going to sound so just like annoyingly everything in moderation, blah, 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 which I feel like if my past self was listening to my current self, she would probably be annoyed. But I think if I talked to her for longer, I would be able to get through to her. But I mean, honestly, like truly what turned things around for me in my attitude towards conventional medicine, this story might contain some TMI bits, but I'll try to avoid that as much as possible. I found myself with what seemed like a Bartholin abscess, Bartholin cyst. If you don't know what it is, look it up if you feel like it, or not if you don't. But it's a very painful enlargement in a very vulnerable region, and I was so just afraid of and biased against doctors that I sat with this thing for several days rather than going to the doctor. And of course I had all of my like really sophisticated rationalizations for why that was like a really good decision. But obviously it was motivated just by my anti-Western medicine, anti-pharmaceutical bias. And it resulted in a lot of pain. I did eventually have to go to the doctor. They had to lance it and I had to go on antibiotics, and that started a very interesting phase of my life where this kind of became a recurring problem, which is a whole other can of worms because they kept insisting that it was an infection. I kept insisting that it felt extremely autoimmune in nature, because just like the relapsing, remitting nature of it, the types of things in my life that would trigger flare-ups, like, yeah, all of that. But that's kind of a different topic. The point is that all of a sudden I was in this situation where there was a drug that actually worked to manage this. Just randomly found out that the antibiotic Augmentin like would take me from being in really intense pain to being in no pain in like a matter of hours, and it felt like magic to me, absolute magic, especially as somebody who has been on a lot of drugs and not had any of them work, except Tylenol. Love me some Tylenol. Like if you have a headache, take a Tylenol, man, it's a solid invention. But yeah, so that experience, that phase in my life really forced me on a visceral level to reconsider my relationship to medicine, to modern medicine. And ultimately, I have now arrived at a place where I'm still very highly aware of all of the shortcomings of modern medicine, all of the not so, I don't know, I don't want to say like sketchy ways that the pharmaceutical industry operates, because it's pretty tightly regulated. It's more that the most, like, the incentives are a little bit off. Like, obviously everything is motivated financially and not for the betterment of suffering patients. It just so happens that in the pharma industry, we've somehow managed to, like, sort of align those incentives so that a lot of people do benefit. Um, but I do think that, an additional issue is just that, like, we're very stuck in a very specific paradigm for understanding the human body and understanding how disease ought to be treated or managed. And that paradigm is extremely entrenched in pharma research and academia. And given that, you know, we've the whole pharma industry has, like, tooled up to support this paradigm, like all of the research methods, all of the, like, assays, the types of drugs that are investigated, the types of methods that are developed. Like, it's all, like, basically you're either going to take a pill or you're going to, like, inject a substance into yourself. And that is like medical advancement, when obviously there are so many other ways that a human body can be manipulated therapeutically. And so I do think that the whole medical establishment is quite narrow-minded in its paradigm, and that's not ideal. But my point, this is a tangent. My point is that I still see all of these shortcomings really clearly, and, like, still don't think that it's that having to be on a drug for the rest of your life, like, that doesn't constitute a cure. That doesn't constitute, like, the end of medicine. Like, the end goal of medicine should be to allow the human body to heal fully and not be, like, dependent on something that has side effects forever. Like, that's just my personal opinion, which I also happen to think is objectively correct. But oh no, I lost my train of thought again. Yeah, the point is that I still have all of these things very much in my head, and I will still go on lengthy rants about it, but the fear has been taken down a few notches, while the appreciation for potential upside is now something that has space in my brain. And really the practical upshot of that is, I guess, that I have a kind of normal relationship with pharmaceutical intervention now, where it's like, if I've tried other stuff and I'm, like, having a symptom or suffering in a way that's, like, really impacting my quality of life or is harmful in some way to my long-term well-being, and there's a drug available that's being recommended to me by a doctor, like, yeah, I'll give it a shot. And I think my past self would have really, I mean, of course not trusted the doctor, would have really dwelled on the potential downsides, like, not just the kind of common side effects that are fairly, like, minor usually, but, like, the 0.01% of people who, like, have some irreversible harm from whatever a thing is. And then if that wasn't enough to deter me, my brain would then focus on, like, well, long term this just wouldn't be sustainable because it's just not healthy to stay on something like this long term. So, like, why even start it to begin with? Like, do something else. And yeah, I don't know, the brain is really good at justifying its emotional biases. So yeah, I gotta say it's a much nicer way to live. And I also have to admit that, like, if I were to try, like, the next big drug and have a really bad irreversible effect from it, there's a really good chance that that would, like, re-trigger this, like, extremely fear-based way of relating to that segment of medical care, and I would go back to this state of like not trusting anything, being really afraid, and like understandably so. Um, and like that's just one of the hard things about life is that some of the worst things that can happen to you aren't things that you can control or prevent or like pre mitigate in any way. And for me, and I'm sure I'm not alone in this, that's a difficult reality to accept, because it just seems like when the stakes are so high, you should be able to do something to prevent that kind of tragedy from happening to you, but you actually just can't. Like sometimes really bad things happen, and like odds are it's not going to be you, but sometimes it could be you, and like you can't really live your life based on being afraid of that tiny percent chance of the worst case scenario happening, because then you're just kind of making your day-to-day life guaranteed less pleasant, versus if you just live on the assumption that you're probably not going to be the 0.01%, then you get to enjoy your life, and maybe you'll end up taking a drug that actually helps temporarily or long term. Yeah, I think that's probably enough on this topic for today. If any of you relate to this, I would love to hear from you in the comments, because it feels like such a weird, like, niche specific thing to talk about, but just given the epidemic of like chronic illness that the medical establishment isn't always great at managing to the utmost level of quality of life that people might prefer, I can imagine that my experience is a lot more common than I may think. So yeah, hope everybody has a wonderful rest of your March 1st, and yeah, see you next time.